In our interview this week, Dr. Aliyu Sani talks about the rate of HIV and AIDS infection in the country. Dr. Aliyu Sani, you're welcome to the program.
Thank you for having me, Gloria.
Well, let's begin this way. Nigeria has the second largest HIV epidemic in the world and one of the largest, the highest rates of new infection in sub-Saharan Africa. You would have to confirm that. But exactly why are we in this situation?
So it's partly to do with the size of our country. We have a very large population, 190 million. So even if we did have a prevalence of 1%, we'll still have a fair number of people living with HIV in the country. Our current estimates are at around 3%, 3.2% prevalence. But as you're probably aware, we're in the midst of doing a major survey, a national AIDS indicator and impact survey.
Even on that, I understand if you had done up to 75%?
80.
Okay.
So we've reached 80% in terms of the enumeration areas and the households that need to be covered. We are very optimistic that we will finish the field work by the end of December and we'll have results by March. And the landscape will change because this is the first time we're getting very accurate, precise data on the state of the HIV epidemic. Well, it's very expensive, Gloria. Our partners, the US government and Global Fund, are spending $91 million to deliver on this. And it's important because you cannot plan if you don't have good data. The data we've had in the past has very wide confidence intervals. So
give us a comparison between the past.
So for instance, in the past, if we say we have let's say 3 million Nigerians living with HIV, that confidence interval could range anything from 2.5 to 4 million people because it's an estimate. But the more people you screen, the more people you randomly sample in a scientific way, the narrower that confidence interval becomes. So we're pretty confident that the results that we will get in March will be more precise and it will be better for planning. Because a lot of our partners currently still struggle to get that positive. They will go to certain parts of the country and they'll test a lot of people in order to get one positive.
Having done this survey, a number of times, I'm almost certain you get almost the same indices reappear. And how encouraged are you? Because there's a lot of money going down the drain just to do this exercise.
So there is, but it's money well spent, in a way.
How is that?
Because we know from the areas that have, at the moment, relatively low prevalence, such as parts of the north, for instance, whenever we ask our partners, our implementing partners, to give us targets, let's say to put 80,000 people on treatment in a year, they struggle to get those 80,000. The areas that have high prevalence will continue to have high prevalence, and that's what the survey will show.
What areas are these?
So I wouldn't want to put too much emphasis on specific states, but we know that parts of the north central, the northeast, the southeast, and also parts of the south as well have relatively high numbers. But just to give you an idea why it's important to get the data right, looking at our targets in the last 4 or 5 years, if we were hitting our targets in terms of the number that we need to put on treatment, we would have had 1.5 million Nigerians at least on HIV treatment. At the moment, we have 1.1 million. That means that money was budgeted and we should have got 1.5 million. But because we were not absolutely certain of the places where we need to go and test, you end up spending the money looking for the person living with HIV, at the end of the day not hitting your target, and that money still gets spent. So it's better to spend money and define your problem. If you have a problem, define it clearly, and that's the only way you can have a good plan.
When you say 1.1, are you talking about across the states or still in a concentrated region? No?
So what we have is a mixed epidemic. There are parts of the country, as I said, that have relatively low prevalence, but across the country we have close to 1.1 million Nigerians currently on treatment. Some states have more, some states have less. But there's no state in the country that doesn't have a person living with HIV on treatment.
You see, recently the Ministry of Health mentioned that not many Nigerians are aware of the HIV and AIDS status, and even the United Nations observed that Nigeria still falls short of providing the recommended number of HIV testing and counseling sites. We're wondering, so there's a lot of money going out on this side and this is still lacking.
Yes, indeed, but that's not surprising, is it? Because HIV, in as much as HIV is an epidemic, but it covers only a very small part of the population. You're talking about 3%. So it means 97% of the population in Nigeria will not have HIV. So if I'm testing, for instance, unless I test carefully, unless I really go after populations that have a high risk, such as key populations, for instance, or certain parts of the country where there are major transit networks, where you have key populations there, or I look for people who already have HIV and test their partners, what you're going to find is you will be doing a lot of work in order to get a gain. And it's just like with everything else, you have a law of diminishing return. As we put more and more people on treatment, as we identify more and more people, you're going to have less and less that have HIV. And therefore, the amount of work, the amount of resources that will go into finding those last bits, because I'm very confident that we are at the last mile. I'm not going to preempt.
Last mile?
Last mile in terms of getting people on treatment, yeah. I'm not going to preempt the results of the survey, but parts of the survey results will show that we are actually doing very well as a country in terms of the efficiency of our treatment program, in terms of compliance. It's going to show that Nigerians actually take their drugs when they're sick.
But we still have a lot of people who are very unaware. How do you go about, really convincing people, especially those who, even apart from being unaware, those who are stigmatized? I know there's been a lot of efforts towards stigmatization and how to get people to come out of their shells and actually save as many lives as possible.
So the theme for this year's World AIDS Day is know your status. Without knowing your status, you cannot access treatment at all. That's the gateway into the HIV program. We know there's still a lot of stigma and discrimination going on. We know that we need to put a lot more work. A lot of that stigma and discrimination has to do with the way HIV emerged. It emerged as a sexually transmitted infection. It came up in a part of society that are already considered to be disadvantaged in a way, that are not easily accepted within the mainstream population. So it's only natural that you'd have that stigma and discrimination. But the good thing is, with the treatment now available, it's no longer a death sentence, and people are living very healthy lives. If you meet somebody living with HIV on treatment, for instance, on the street, you're not even going to be able to recognize them. So that way the stigma goes down, because a lot of the stigma also has to do with fear. You see somebody who's very sick, who is wasted, who is coughing, who's dying, and you go, oh my God, is this HIV? I can't touch this. I don't want to have anything to do with this person.
But there are still reports of low levels of antiretroviral treatments.
So
based on what you just said.
Yes, so we have 1.1 million people on treatment. If we use our original estimates, it means we're only about a third of the way in terms of getting people on treatment. The survey is not going to show that everybody that needs to be on treatment is on treatment. We'll still have that gap. We'll still need to have more people diagnosed in order to get everybody on treatment. But again, I would say that the advantage of treatment isn't just to the individual. It also has a public health good. Because if you're on treatment and you're virologically suppressed, which means you don't have the virus in the bloodstream, you're not going to spread the infection to your partner, and you're not going to spread it to a pregnant mother will not transmit to her unborn baby. So that also reduces the stigma. It reduces the fear when it comes to HIV, because a lot of the fear has to do with transmissibility. People are afraid that they will catch it, maybe from coughing, maybe from sneezing.
How much has the treatment cost so far for this year?
So the treatment, we estimate based on our own national program, we spend between about 60,000 naira per patient per year. So it's not huge. What makes the HIV program expensive is the numbers. So if you put 60,000 and you multiply it by 3 million, that's a lot of money. Oh,
we simply keep our fingers crossed that you will get as much support and collaboration on these matters so that we can see less frequent deaths and have a healthy nation, so
a healthy country.
Thank you very much for coming on Dateline Abuja.
It's always a pleasure, Gloria. Thank you.
Well, thank you so much for your mails and tweets as always. Keep sending in your views and comments using the email address and Twitter handles on your screen. Also, be sure to share anything happening within your locality. Don't you forget, you can view the program on youtube.com/channelsweb/videos. Thank you for watching this week. I'm Gloria Umezuki. See you again.